And welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honourable Blaine Higgs, Premier New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont la médecin hygiéniste en chef, la Dr. Jennifer Russell et l'Honorable Blaine Higgs, Premier ministre. Dr. Russell.
Stormy weather, the snowy one out there. Merci Bruce, thank you Bruce. Bonjour à toutes et à tous. Good afternoon everyone. Je tiens d'abord à vous fournir une mise à jour au sujet des foyers de soins Villa des Jardins et Manoir Bellevue à Edmundston. Santé publique a mené plusieurs rondes de dépistage de masse dans ces deux foyers de soins au cours des 2 dernières semaines, soit depuis le début de cette éclosion. Les tests de dépistage ont permis de confirmer qu'il y a 19 nouveaux cas à la Villa des Jardins, soit 10 résidents et 9 employés et préposés aux services de soutien. Le nombre de cas confirmés dans cet établissement s'élève maintenant à 32. Le dépistage de masse de résidents et de membres personnels du manoir Bellevue a été effectué lundi et nous attendons les résultats. Jusqu'à présent, il y a eu 55 cas confirmés de COVID-19 parmi les résidents et les membres du personnel de cet établissement. Nos équipes provinciales de gestion rapide des éclosions demeurent sur place dans ces 2 établissements pour aider les membres du personnel pour gérer la situation et aussi pour contrôler les infections.
Everybody, please place your mics on mute. Merci, s'il vous plaît. Au micro, s'il vous plaît.
Et le travail qu'ils font est très, très, très important. Ils travaillent tellement fort à ce moment-ci. Toutes nos équipes de santé publique, extramurales et aussi Ambulance Nouveau-Brunswick et développement social et les réseaux, on travaille tellement fort à ce moment-ci. Before I begin, I want to provide an update on the situation at Villa des Jardins and the Manoir Bellevue nursing homes in Edmundston. Public Health has conducted several rounds of mass testing at these 2 nursing homes over the past 2 weeks after outbreaks were declared. Testing at the Villa des Jardins has confirmed 19 new cases of COVID-19 at this residence. This includes 10 residents and 9 employees and support workers. This brings the number of confirmed cases at this residence to 32. Mass testing of residents and staff at the Manoir Bellevue was conducted on Monday, and we are awaiting the results of these tests. To date, there have been 55 confirmed cases of COVID-19 among residents and staff at this facility. Our prompt teams remain on site at these 2 residences to provide care and support and assistance to staff in infection control. And I just, again, want to extend my thank yous to all of the people working in these facilities right now. We've also made a call out for volunteers to help out in those situations, and we have had people respond to those calls from other areas of the province. So thank you very much for all of your help and support. At our last briefing, I talked about the threat posed by new variants of the COVID-19 virus. New strains of the virus have appeared, which spread faster and more readily than the original version. And I mentioned that these variants are present in Canada and that they would soon arrive in New Brunswick. Well, that day has arrived, and we can confirm now that there is the UK variant of COVID-19 in our province. So the lab has confirmed that we have in Zone 2, 2 cases of the COVID-19 variant, which is the St. John area, and 1 case in Zone 7, which is the Miramichi area. And these are all the UK variant. So 2 of these cases are related to international travel, and the other is related to travel within Canada. These individuals have been informed and have already been in self-isolation. Nous confirmons aujourd'hui que le variant du Royaume-Uni de la COVID-19 a en effet fait son apparition au Nouveau-Brunswick. Les tests en laboratoire ont permis de confirmer que 2 cas de COVID-19 signalés dans la zone 2, soit la région de Saint John, et qu'un cas signalé dans la zone 7, soit la région de Miramichi, sont associés à la nouvelle souche du virus qui a été décelée pour la première fois au Royaume-Uni. 2 de ces cas sont liés à des voyages internationaux. Comme vous le savez, c'est présent dans 30 différents pays à ce moment-ci. Alors que l'autre est lié à un voyage à l'intérieur du Canada, on sait qu'il y a plusieurs provinces ici au Canada qui ont le variant du Royaume-Uni. Ces personnes en ont été avisées et sont déjà en auto-isolement. Public Health is continuing their work in these zones. We are conducting surveillance as well to monitor for these new strains. Now, the arrival of the UK variant, the United Kingdom variant, will put more pressure on our health system and our immunization rollout. And last week when we talked about it and I made the announcements around changes in travel restrictions, et cetera, and our border measures, this was as a result of the news about how quickly the variant can transmit. It was also around trying to protect our systems and outbreaks as they are right now so that we can protect our vaccine rollout program. We really need to get our most vulnerable people vaccinated as quickly as possible, so meaning our long-term care facility residents. So I do have some way to illustrate that, actually. I have a slide coming up in a minute. It is a really fast-moving strain. It infects people very, very quickly and in higher numbers. And if this strain, when the strain gets into our population, it'll be very difficult to get ahead of it and stay ahead of it with contact tracing and self-isolation as we have done in the past. So we are having discussions here in the province as well as at the national level around what other measures can we do to manage these types of cases. So I just want to show you a graph of what would happen if the cases that we've had in the month of January were the UK variant. And there's 2 different versions of that. So, you know, the low estimate whereby you can see that we would, with no variant, so the first column from January 5th to 28th of 2021, we saw 567 cases of COVID-19. But if that were to have been the UK variant that was involved in those outbreaks, we would have seen, in terms of the best case scenario, 1,004 cases. Worst case scenario, we would see 6,218 cases. So that is just an illustration of how quickly the numbers can go up very, very dramatically with this variant. And that's why our concerns have been to do everything we can to strengthen our measures that are already in place and again, try to protect our healthcare system, try to protect our vulnerable populations, and try to protect the rollout of our vaccination program. So again, over the next month, if that variant had been at play, we would have seen more than 6,000 cases by the end of the month. That's how quickly it can go up. So now more than ever, all New Brunswickers really must avoid unnecessary travel, both within and outside the province. No version of COVID-19 can move on its own. It needs people to move it. So, une fois que cette nouvelle souche se transmet au sein de la population, ce sera plus difficile de prendre l'avance sur le virus à l'aide de la recherche, de contact et de l'auto-isolement, comme nous avons pu le faire jusqu'à présent. Il est plus important que jamais pour tous nos citoyens du Nouveau-Brunswick d'éviter tout voyage non essentiel tant à l'intérieur qu'à l'extérieur de notre province. Aucune forme du virus responsable de la COVID-19 ne peut se déplacer à elle seule. Le virus a besoin des gens pour se déplacer. When we stop moving to the greatest extent possible, we limit the opportunity for the virus to spread to new hosts. And that is what we all must do. Aujourd'hui, j'annonce qu'il y a 25 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Il y a un nouveau cas dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. Il y a 24 nouveaux cas dans la zone 4, soit la région d'Edmundston, de Grand-Sault et de Saint-Quentin, dont les 19 cas au foyer de soins de la Villa des Jardins, comme je l'ai mentionné plus tôt. Today, there are 25 confirmed cases of COVID-19 in New Brunswick. The new cases are in Zone 1. There is one new case, that's in the Moncton area. Zone 4, which is the Edmundston, Grand Falls, Saint-Quentin area, there are 24 new cases, and this includes the 19 cases at the Villa Desjardins nursing home that I mentioned earlier. One case reported on January 31st in Zone 2 has been confirmed as a false positive, so we've removed that from our reporting. False positive results are very rare, but they can occur due to a number of factors. We now have 267 active cases of COVID-19 in New Brunswick, and this includes 2 individuals in hospital, both of whom are under intensive care at this time. So I do ask that you keep them in your thoughts and prayers right now. There are also 1,027 New Brunswickers in self-isolation, helping to limit the further spread of this virus. And for those whose lives have been touched by COVID-19, the support of family and friends is more vital than ever. And I think it's safe to say that all New Brunswickers' lives have been impacted by COVID-19. So let's support each other, reach out to others when you can with whatever they might need. So the best thing we can do is to stay at home as much as we can. We know that out-of-province travel was the direct cause of 58 of the 655 confirmed cases of COVID-19 reported in New Brunswick in January. So roughly half of those 58 travel-related cases were for work, and roughly half of the 58 travel-related cases were for non-essential reasons. And so regardless of the travel types, transmission has occurred despite self-isolation and testing from those 58 cases, resulting in hundreds of primary and secondary infections that spread across the province. I'm not saying that all of them transmitted, but of those 58, several of them in both categories did transmit, and it really only takes one case to start an outbreak. So it's really important that we try to limit the transmission as much as possible. And again, highlighting the fact that the variant, the UK variant and other variants will make this more important. We can take further steps to limit the cases and slow the spread of the virus, and we have. That's why we brought in the new restrictions and border measures, etc. last week. There are always going to be people moving back and forth across our borders. There's no question. Our healthcare system depends on it. Our economy depends on it. Our essential services and needs, that's how we access them, by having them have the ability to cross our borders in terms of distribution. So we know that we've had so many cases in the last month. It's been a tough month. And I think the message today really is avoiding travel that's unnecessary. Don't travel outside the province or the country unless it's absolutely necessary. And if you are planning a vacation outside of the province or outside the country, it is a very risky time to travel right now, not only for your own safety when you get there, but when you return back. Again, travel-related cases continue to be driving outbreaks that lead to long-term care facility outbreaks, affecting healthcare workers, affecting school closures, affecting business closures, affecting whole entire zones that then end up going to red and then lockdown. So we need everybody to stay as close to home as possible. Please wear your mask when you're in public. Please maintain 2 meters of physical distance when with others. If you have symptoms of COVID-19, no matter how trivial they may seem, please get tested. We have reports every single day, and I'm on the calls where they tell us what the callback times are, how many people are calling, how many people are getting tested, what the turnaround time is, etc. And we're doing quite well in terms of capacity right now, so please get tested immediately if you have symptoms. January was a very tough month, there's no question. We are still going to face other challenges, but January was definitely a tough month. Nous avons dû signaler un plus grand nombre de cas du COVID-19 au cours des 31 derniers jours qu'au cours des 9 derniers mois de 2020. Les choses pourraient continuer à aller tout aussi mal pendant les semaines et les mois à venir si nous ne prenons pas des mesures urgentes pour limiter la propagation de ce virus. We saw more confirmed cases of COVID-19 in the past 31 days than the entirety of the last 9 months of 2020. It is a bit shocking to be in this spot, but we have excellent teams on the ground that are working tirelessly. I mean, 7 days a week. It's incredible how much work is being done to contain these outbreaks all over the province. in terms of everybody pitching in. The weeks and months ahead could be very challenging unless we all take urgent action to limit the spread of this virus and its variants. And as I mentioned, we have put more measures in place, but we need New Brunswickers to continue to do their part. It is time for us to rediscover the spirit of teamwork, empathy, and cooperation that made New Brunswick a leader in the control of COVID-19. When we work together, we definitely can achieve great things. And we have done this before, and I know we can do it again. Thank you very much.
Good afternoon. Bonjour. Before I begin today, I want to take a moment to thank everyone for their condolences on the loss of my mother. My family and I appreciate the many kind words and support that was shown from the high to the low. She received hundreds of cards for celebrating her 100th birthday, and I had the opportunity to read them to her, and she would be asking, who's this person, who's that person, and many of them, of course, I didn't know myself, but you took the time to send her a card, which she and I and my brother very much appreciated. You helped us to support not only her life of 100 years, but then in remembrance of her recent passing. It was a comfort to me and to my family, and I'm very, very appreciative. As Dr. Russell said, we have 25 new active cases in the province today and have learned that the UK variant of the virus is now with us. Ce n'est pas une surprise, car le virus est partout autour de nous. Et il est impossible de fermer complètement nos frontières. Nous savons que le virus entre initialement dans notre province par le voyage. It's impossible to completely eliminate travel into and out of our province. The supply chain is critical, and goods must continue to move. We are on the front lines of the border with Quebec and the border with Maine. People who live and work across these borders must be able to come home, and we've tried to accommodate that as we strengthen our travel measures. But each and every time someone travels, for whatever reason, there is a risk. And we must take every measure possible to mitigate it. The virus doesn't move on its own. People move the virus. Since we had our first case in New Brunswick on March 8, 2020, Public Health has determined that 20% of the cases of COVID-19 in the province were travelers. These cases sparked the rest of the active cases in New Brunswick. As contact tracing has shown, these cases can spread further and extend beyond those first close contacts and result in the outbreaks that we are seeing here at home. Malheureusement, ces inclusions se traduisent souvent par des infections parmi les gens qui sont médicalement vulnérables. Parmi notre population âgée qui vit dans des établissements de soins de longue durée et parmi nos travailleurs de la santé. Combiné à la menace qui représente les nouveaux variants de virus, nous savons qu'il était nécessaire d'agir rapidement et de manière décisive. That is why Cabinet and the All-Party Cabinet Committee on COVID-19, on the advice from Public Health, decided at this time to require that anyone entering New Brunswick, including rotational workers, complete a 14-day self-isolation away from others, preferably in a hotel, granny suite, or attached apartment. If, as an absolute last resort, rotational workers choose to isolate with other people, everyone in the household must also complete a 14-day isolation. Si vous passez votre période d'isolement avec d'autres personnes, rappelez-vous ceci. Toutes les personnes de la maison doivent rester à la maison. et elles ne peuvent pas se rendre au travail, à l'école ou d'autres endroits, à moins d'une urgence médicale. Nous vous recommandons fortement de faire tout ce que vous pouvez pour trouver une autre solution, car vous pourriez mettre toutes les personnes de la maison en danger. In addition, if anyone in the home develops symptoms, they must get tested, and everyone in the household must begin their 14-day isolation again from the beginning. Cross-border commuters who regularly travel for work and post-secondary education must do weekly testing for COVID-19. We are evaluating our travel requirements. We are evaluating the essential need of every movement so that we can control the spread of not only COVID-19, but the variant that has now emerged. We can't do enough to prevent the spread, and we will continue to be diligent in all parts of our province. Mandatory periodic testing is also required for New Brunswick residents who are truck drivers, as well as commercial air, rail, or marine operators who have entered the province. Nous comprenons que c'est une situation difficile pour les familles et pour les personnes qui sont touchées. Je peux comprendre votre frustration et votre tristesse. New Brunswick have already sacrificed so much, and this virus continues to demand that we all continue to do more. We will evaluate every case closely and evaluate it for risk and minimize our risk as much as we possibly can. We know that being away from one's family is already difficult without added hardships. But there is a greater danger out there for our entire province with these new variants. Nous devrons faire ces sacrifices pour avoir de meilleures chances de maintenir un nombre de cas plus élevé et de protéger les personnes les plus vulnérables. Nous avons besoin de temps pour vacciner un plus grand nombre de personnes afin de mieux nous défendre contre le virus. We continue to work as quickly and efficiently as possible to vaccinate the most vulnerable residents of our province. Currently, about 1 in 4 nursing home residents have received at least 1 dose of the vaccine. And of the more than 27,000 healthcare workers in the province, which includes staff in long-term care facilities, 10,136 have received at least 1 dose of the vaccine. As of January 30th, we've administered doses to 17,277 New Brunswickers, and 4,460 people have been fully vaccinated. More than 1,300 people are scheduled to receive their second dose of Moderna vaccine this week. Ces deuxièmes doses seront administrées aux personnes qui ont participé aux premières cliniques de vaccination dans l'établissement de soins de longue durée au début de janvier. Nous avons adopté une approche stratégique pour la distribution des vaccins et décidant de vacciner les personnes les plus vulnérables, incluant les travailleurs de la santé et les autres membres de personnes des services de santé. Une réduction du nombre de la livraison ou du nombre de doigts par livraison a des répercussions sur notre capacité de distribuer le vaccin aux gens de Nouveau-Brunswick. Cependant, la personne effectue une révision de notre plan afin de déterminer la meilleure façon de gérer ces réductions. Though this delay of vaccines has been disappointing, we expect that we will have access to more vaccines moving forward. We are committed to our priority of getting all residents of long-term care facilities vaccinated by March 31st. This, of course, is contingent on the federal government being able to deliver the number of vaccines we've been told we will receive. We will continue to keep New Brunswickers informed as more information becomes available. Nous reconnaissons que les répercussions de la pandémie continuent de se faire sentir partout dans la province, incluant les propriétaires des petites entreprises. Businesses and employers who have been impacted by COVID-19 are now able to apply for the New Brunswick Small Business Recovery Grant. This grant will provide relief of up to $5,000 for eligible small businesses. The grant is available to businesses located in a zone that was subject to orange or red phases for at least 1 week from October 10th, 2020 to March 31st, 2021. For more information on eligibility and how to apply, contact the ONB Business Navigators at nav@navnb.ca or 1-833-799-9966. I know we're all tired of COVID, and we will continue to be so until we're vaccinated and we can get back to life as we once knew it. But for now, let's get back to what we knew COVID was like before we get into red and orange and shutdown. I ask that each of you continue to stay strong in the months ahead and continue to follow the rules that have been set out by public health. Together, we can keep New Brunswick as a model that has withstood the test of COVID. Continuez à respecter la directive de la santé publique, ainsi que les règles qui s'appliquent à la phase de la zone où vous habitez. We will continue to work together, and that's how we will manage better. We will continue to keep ourselves health and safety because every one of us will look out for each other. This is our only way to have continued success and to get our count back to where it needs to be and flatten the curve once and for all. Thank you. Merci.
Merci, Monsieur Premier Ministre, Dr. Russell. Thank you both. We have 24 reporters on the line. We will try and do our utmost to get through each and every question. So please ensure your question is succinct and to the point. Nous allons maintenant procéder aux questions des journalistes. Chaque journaliste aura une question. Sois précis et clair, s'il vous plaît. Voulez-vous assurer de désactiver le son de vos micros? We'll now proceed with questions from the members of the media. Each reporter will have one short question. You have the right to pose your question in the official language of your choice. Please ensure your mics are placed on mute. Laura Brown, CTV.
Hi there. I'm wondering how many of the 58 workers or 58 people that were for the travel-related cases were rotational workers. So what percentage of them were actually rotational?
So the breakdown that I have, Laura, is around how many were travel-related and how many were there were essential versus non-essential. And the non-essential travelers were about 24, and the essential travelers were, oh, I have the number. Sorry, Laura. Yep.
For section 1.
No, it's not in, it's not where I thought it was. Laura, I'm going to have to come back to you with that. I do have that information. It's just not where I thought it was.
Okay.
I just know the breakdown in terms of travel, essential travel versus non-essential. There were 20 of the 58 who were essential travelers. And then the breakdown of that, there were rotational workers and daily commuters, as well as truck drivers in that group. So, and there were 24 non-essential travelers and 4 compassionate exemptions.
Vicky Hogarth, CHCO TV.
Thanks, Bruce. Dr. Russell, since the new variants are a learning curve for all of us, can you give us a little more detail on how the strain got into the province without compromising anyone's identity? Were they related to international travel outside of North America? Were they unavoidable trips for work, or were they personal trips?
At this point in time, I can just tell you that 2 of the cases were outside of the country and 1 was outside the province. So, and again, the variant is present in 30 countries around the world right now, the UK variant that is, and the UK variant is present in, I think, 4 provinces right now, if not 5.
Thank you, Dr. David Coach, Telegraph-Journal.
Hi, the question is for Premier Higgs. Looking at the topic of rent hikes during the pandemic and calls for rent control, on December 3rd, you said the government found a better understanding of the situation and taking action. And last month, you said you were awaiting a report about the extent and significance of the issue. Have you received a report, and has the government made a decision on rent control?
We haven't made a decision yet, but we have received some reports. Most recently, the CMHC report that I think was just issued the last part of last week, maybe the 28th of January. So I'm reviewing that now, and the other stats that we have picked up through our Service to Brunswick and the Reynolds Group in terms of evictions and notices. So we're going through that at this point, but the report I just received was late last week.
Thank you, Premier. NTR, Huddle Today.
Hi, thank you. First of all, my sincere condolences, Premier, for your loss. I want to ask a question about the grant for small business owners. A lot of small business owners said they don't qualify for the recovery grant because of some requirements, like the 2 full-time employee requirement. What are the considerations behind these criteria for eligibility? Thank you.
Firstly, thank you for your thoughts regarding my mother's passing. In relation to the grants, the criteria set was so that we could actually understand the impact that it's had on businesses and the fact that they were, registered businesses as such, and that's why you had a minimum number of employees because otherwise it could become very difficult to manage or to deal with effectively. So I guess if there are specific businesses that feel they don't qualify and the reasons aren't understood by them, they should review that with ONB. Certainly they can make their case, because that is a system we've set up to understand clearly the direct impact that businesses have had and how we can best mitigate that through our grant formula.
Thank you, Premier. Thank you, Ms. NTR. Silas Brown, Global TV.
Hi there. I'm curious, what has the province learned from the last month and the outbreak that we've been contending with? And is there anything that the province might have done to avoid or deal with this outbreak differently?
Hi, Silas. Well, I've been thinking about all of those types of scenarios in terms of where we've come from. When you think about risks and how we have to keep changing our approaches based on risks. Last summer, the risks were low. We had a certain amount of freedom and we had very few restrictions in place. We had kind of the bare minimum of restrictions in place based on the risks that we were seeing all around us at that time. The fall, things changed. We saw the number of cases increasing in Canada. The importation, travel was always going to be the risk for importation of COVID-19, and that's still not going to change. But the risk of that importation with each and every traveler started to increase, whether it was an essential traveler or a non-essential traveler. So we started having the testing strategy around travelers, essential travelers. And then just right before Christmas, right before the holiday season, and into the holiday season in early January is when we started to learn about the variants and the dangers that was going to pose at the same time that we were going to be rolling out our vaccine program for COVID, and then getting, the information that our doses that we were planning to receive weren't necessarily going to be in the same amount and time frame that we had hoped. So I think there's a combination of things that we're looking at in terms of risks and how to manage all of those risks as things evolve. That's been our goal, is to just continue to manage those risks as they evolve and change. So I don't think there's any one thing that contributed to our outbreaks in the holiday season. However, when you think about the Swiss cheese approach, our border measures are very, very important. Travel restrictions, the self-isolation pieces, the testing pieces, wearing masks, the 6 feet distancing, washing your hands, disinfecting, keeping your close contacts low. all of those things combined, even if they're all done extremely well, there still are chances for the virus to get through all of those layers of protection. So I think when you're facing an overabundance of number of cases across the world in other jurisdictions and increases in all those kinds of risks, and any breakdown in any one of those barriers of protection will allow transmission. So we're now at the point where we just really want to get the outbreaks under control that exist right now and prevent new outbreaks from taking place and getting hold in terms of the variants.
Thank you, Doctor. Thank you, Mr. Brown. Pascal Rachnac, Radio-Canada.
Oui, bonjour. Ma question est pour la Dr. Russell. J'aimerais savoir l'arrivée du variant britannique au Nouveau-Brunswick. Qu'est-ce que ça va changer dans votre stratégie, dans la lutte contre ce coronavirus au Nouveau-Brunswick?
Alors, il y a des changements qu'on a mis en place avant que les variants arrivent. Et c'était vraiment pour protéger la population contre les variants. Alors, être en phase orange dans toutes les régions qui n'ont pas des cas à ce moment-ci, avec le nombre de les mêmes 10 pour les contacts étroits, ça c'est très important pour nous protéger contre les variants. Changer les mesures aux frontières, changer les règlements sur les protocoles sur le voyage essentiel et non essentiel, très, très, très important. Alors, on essaie de aussi suivre ce qui a été fait au niveau fédéral en limitant le nombre de voyageurs qui rentrent dans notre province. Ça, c'est la meilleure manière pour nous protéger. Au niveau de les variants comme tels, en comment gérer les cas, on a des discussions au niveau national et aussi au niveau provincial pour faire des décisions, pour faire des changements dans la manière qu'on gère les cas, parce que les risques sont plus élevés. Alors, ça veut dire la manière qu'on avise l'auto-isolement.
Harry Forstall, CBC.
Thank you, Bruce. This is for Dr. Russell. Dr. Russell, we now face a variant that moves as fast, perhaps even faster than we can. What will the next wave look like, and how concerned are you that the shortfall in vaccine delivery comes just as the UK variant arrives in New Brunswick?
Well, you probably noted a change in my tone last week, and I think it was the weight of all of those new pieces of information colliding all at the same time in terms of creating a perfect storm for having these challenges that we're facing right now. So we have increasing number of cases around the world, increasing numbers of variants around the world. We know they're in this country. We know that they're in our province now. We've tried to put in all of the, tighten up every measure of every layer of protection we can, from border measures to travel restrictions to gatherings, to keeping people in orange around the province who don't have cases in terms of the zones, and keeping the steady 20. Every single measure that we can strengthen from a public health perspective, that is what we're doing right now. In advance, we're planning to do that in advance of the variants arriving, so that then we would have a better ability to try to either stamp it out quickly or stay ahead of it once it arrived. As of right now, I think we have put everything in place that we can. The next conversations at the national level and at the provincial level have involved talking about the details of case management now of these cases. So when you have a case of the variant, what does that mean around contact tracing? What does that mean about self-isolation? Do we have to make changes? So those are the conversations we're having right now. But I think in terms of every strengthening of every measure, and again, I've got a little diagram to remind myself of that Swiss cheese approach with all those barriers. So border measures, self-isolation, masking, physical distancing, hand washing, your close contacts. You know, if the variant gets through all of those layers of protection, it only takes one case to start an outbreak. I mean, of the old variant, every single outbreak that ever started was because of one case, and the case can lead to other outbreaks in other areas, long-term care facilities, which then affects healthcare workers, which then affects hospital services, which then can cause, you know, a zone to go to red and then go to lockdown. So it only takes one case to have those consequences. But the problem now with the variant is that each one of those cases that gets through all those barriers can then infect many, many more people very, very quickly.
Thank you. Simon Delattre, l'Acadie Nouvelle.
Oui, bonjour, une question pour Dr. Russell.
J'aimerais savoir, le parti libéral demande la création d'un centre des mesures d'urgence sur le terrain dans la zone 4 pour coordonner la réponse des autorités dans les foyers de soins. Est-ce que vous pensez que c'est une bonne idée et qu'est-ce qui est fait actuellement pour gérer l'éclosion dans les foyers de soins?
Peux-tu répéter la question, s'il vous plaît?
Plus fort, Simon.
Oui, le Parti libéral demande la création d'un centre des mesures d'urgence dans la zone 4 pour gérer les éclosions dans les foyers de soins. Est-ce que c'est une bonne idée et comment la situation est gérée tout de suite?
Premier.
C'est les mesures qui sont en place maintenant dans la zone 4?
Par rapport aux éclosions dans les foyers de soins, on a un manque de personnel. Comment la situation est gérée?
Ben, on a...
votre manque de personnel?
Oui, on a déjà pris des étapes déjà pour annoncer qu'on a besoin des volontaires et on a des bénévoles pour voyager de d'autres endroits des provinces pour aider avec les éclosions. Parce que chaque fois qu'on a une éclosion dans un foyer de soins ou une résidence à long terme, c'est toujours notre équipe de prompt qui est là. Ça, c'est les équipes de santé publique avec développement social, avec le programme extramural et aussi Ambulance Nouveau-Brunswick. Alors, quand les équipes ils essayent de gérer plusieurs éclosions en même temps dans plusieurs résidences, ça pose un problème pour les travailleurs de santé. Alors, c'est pour ça, à ce moment-ci, on fait des appels pour avoir plusieurs supports de travailleurs de santé à ce moment-ci. Parce que les impacts, il y en a des gens qui travaillent dans plusieurs endroits et ça peut pas continuer quand on a des éclosions. Alors, c'est vraiment difficile quand il y a trop d'éclosions puis il y a trop de manque de personnel. Mais on a fait la demande avec les réseaux et avec Vitalité et Horizon et on a trouvé des staffs pour aider dans les situations, dans les éclosions.
I think I would just like to follow up with what Dr. Russell said about certainly what's happening in Zone 4. A lot of great work's been done to contain the activities in Zone 4, and certainly it is very much contained within this long-term care facility. The idea that, that we kind of start criticizing each other at this point is not what has got us to the success we've had to date. We have very open discussions in the COVID Cabinet Committee in which we discuss all issues around what are our risks and what should we be following and what should we change. We have a situation at Zone 4 right on the Quebec border, and we know that that's always been a high-risk location. Travel is going to be our focus at the next meeting, which is going to be happening tomorrow night, and then again on Thursday with Cabinet. And the idea is to review all essential travel and make decisions in relation to what we can change in that regard to minimize risk. I guess I want to reiterate the success we've had to date is working together. We are all COVID tired. Tempers can be short, and political opportunism can flourish. This is no time to start finding reasons to criticize one another. This is a time like no other to find reasons to work together. The new variant addition that we've just learned of brings a whole new dimension to what we're going to be facing here in our province. And we will continue to be successful, but we'll have our most success if the politics is set aside and we deliver for the people of this province in the way that we've been doing together for the last many months.
Thank you, Premier. Gilles Duval, TVA.
Oui, bonjour. La question serait sûrement pour Dr. Russell. J'aimerais qu'on précise quelles sont les conditions par rapport à ce qu'on appelle l'auto-isolement ou la quarantaine si une personne veut aller donner son temps dans un foyer de soins. Est-ce que si on y va une présence, donc qu'est-ce qu'on doit faire après? Parce que ça semble être une barrière là, que les gens voudraient bien y aller, mais ne veulent pas vivre une quarantaine ou une période d'isolement si jamais ils vont donner de leur temps. S'il vous plaît, précisez donc quelles sont les mesures si on va donner du temps dans un foyer de soins.
Oui, c'est une très bonne question. Ça, c'est des protocoles qui sont mis en place avec les réseaux, avec l'ambulance Nouveau-Brunswick et extramural et santé publique. Alors, quand on travaille comme équipe pour aider avec des éclosions, on a des travailleurs de santé qui vont aller à l'endroit pour aider dans les situations comme ça. Et les protocoles qu'on devrait avoir pour la quarantaine, ça serait ça dépend s'ils vont aller travailler à autre place après ça. Mais les gens qui travaillent déjà dans les hôpitaux, ils sont encore, ils auront aussi la capacité de travailler dans les endroits qui travaillent déjà après qu'ils retournent, mais ils font de l'isolement de travail. Et ça, c'est la compréhension que moi j'ai sur les travailleurs de santé qui vont voyager pour aider.
Jean-Philippe Hughes, Radio-Canada.
Oui, bonjour. Ma question est pour Blaine Higgs et Mme Russell. Il y a un groupe dans le Nord-Ouest qui demande l'intervention de l'armée dans les foyers de soins. Les libéraux demandent un centre de mesures d'urgence coordonné. Ma question, c'est quel est votre plan si la situation continue d'empirer dans les foyers de soins du Nord-Ouest?
Alors, je vais prendre la question au niveau des gens qui aident maintenant avec la situation au Nord. On va continuer avec le plan qui est en place maintenant. Oui, c'est difficile à gérer la situation, mais avec les bénévoles qui ont voyagé pour aider à ce moment-ci, je crois que on est en une meilleure place qu'on était. On va continuer avec les dépistages chaque 2-3 jours des staffs puis les résidents, comme tous les éclosions dans tous les foyers de soins qu'on a eu jusqu'à maintenant.
Merci, Monsieur Hughes. Tim Roselle, Global.
Hi, thank you, Bruce. My question is for Dr. Russell. To this point in the pandemic, Dr. Russell, public health has used a certain threshold surrounding, the number of unlinked chains of cases of COVID-19 in order to determine whether or not a zone may or may not move into a tighter set of restrictions, maybe from a yellow to an orange or orange to a red, what have you. Does that threshold change, and if so, how does it change now that the UK variant is present in New Brunswick and, as you've already pointed out, is much more contagious?
Well, I think, again, that's an evolving situation, and all of our triggers are really for our triggers for a risk assessment. So the risk assessment takes in many different components, including hospital capacity, including public health measures, testing, contact tracing, and also the case numbers, types of cases, community transmission, et cetera. So we'll continue to use those same triggers for our risk assessments, but certainly, again, we are having conversations at the national level around and at the provincial level around what we need to do to change the case management approach and in terms of self-isolation as well as contact tracing, meaning the consideration will be given to not just having the close contacts of a case self-isolate, but the contacts of a contact before they become positive, because it does transmit so quickly. So those conversations are going to be ongoing at this point in time. And if there is no transmission of the variant, we're not seeing that pattern, we'll continue with our current measures and our current approach, knowing that the evolution of this will be quite quick, and we probably will have to evolve our approaches with that. But the triggers will still be there for the risk assessments, and we'll continue to use all of those pieces of information for our risk assessments.
Tim Jakes, Campbellton Tribune.
My question's for Dr. Russell. I wonder if Dr. Russell can give an update on something the minister had mentioned last week about setting up more testing capacity at locations in Zone 5 for those who need weekly tests across the Quebec border for work. because the only place to get them was in Dalhousie, and I understand that was causing some delays and distant from the western side of the zone.
Well, in terms of testing capacity around the province, we have done a lot of extra sites. Vitalite is responsible for the sites, and so if they are setting one up, then they would be announcing that.
Thank you. Savannah Odd, Telegraph Journal.
Hi, my question is for Dr. Russell. You said last week, of course, the variants will arrive without us knowing, which is why we're preparing now. But nursing home and hospital workers unions have said the province hasn't had a conversation with them yet about preparing frontline workers to deal with that variant. Today, you've announced the variant is here. So I guess, can you tell me why those conversations didn't happen earlier and what precautions are going to change now in these frontline settings to keep transmission at bay?
Well, one thing that we have been doing at the Department of Health is we've been having engagement sessions with the New Brunswick Medical Society as well as the Nursing Association of New Brunswick, among others, and I think we had one actually with the Pharmacy Association and the college. So we've done a lot of engagement with the associations that would be responsible for the frontline staff, and also because the regional health authorities obviously have a role in that communication as well. We have the Pandemic Task Force that puts out regular memos around different measures, et cetera. But I think our role in terms of engagement has been with the associations themselves as well as the RHAs.
Nick Cunningham, CHMA.
Good afternoon. My question is for either Dr. Russell or the Premier. Can you give an update on any interprovincial arrangement where New Brunswick residents can get tested in Nova Scotia and vice versa, since our borders are so close together?
Yes, we're looking at that for Quebec and Nova Scotia at this moment in time, and I don't have all the details on how those conversations went and where they landed, but as that information is forthcoming, we can provide that, but definitely that is being looked at again in Quebec as well as Nova Scotia.
Don Woodside, All New Brunswick. Marie Sutherland, CBC.
Hi, I think my question is for Dr. Russell. It could be for Premier Higgs. Those graphs that you showed, or the graph that you showed with a worst case scenario of 6,000 plus cases by the end of February as a low estimate, how is our healthcare system and our education system, for that matter, preparing to cope with this? How many of those cases are predicted to require hospitalization?
That worst case scenario is if we don't, if we didn't have all the measures that we have right now, and if new cases arrive that then started outbreaks, that's based on having a starting place of 500 plus variant cases. So the outbreaks that happened in January, that was a projection of what could happen if all of the cases from January were of the UK variant, what that would translate into. So at this moment in time, again, we work with our risk assessments in terms of putting measures in place from red to lockdown, and that's what we have to work with right now in terms of public health measures as we respond to outbreaks, whether they're the variant or not.
Thank you. Nicholas Steinbeck, Radio-Canada.
Bonjour, la question est pour le Premier ministre Blaine. D'abord, mes sympathies. Est-ce que vous avez l'intention de demander au fédéral de l'aide avec l'armée, de déployer des troupes dans le nord-ouest du Nouveau-Brunswick pour venir aider dans les foyers de soins, pour venir sécuriser la frontière? Est-ce que vous avez l'intention de demander cette aide au fédéral à court ou à moyen terme?
Well, certainly in relation to the, deploying the armed forces, we, as Dr. Russell said, we certainly feel that we're able to get resources from around the province to work in the healthcare field and in the long-term care facilities as needed right now. In relation to the border and our going through the essential workers and how many people are traveling, what's interesting is to learn how many people are coming into New Brunswick and how many people are actually going through New Brunswick to Nova Scotia or PEI or maybe on to Newfoundland. So we're actually disseminating all of that information. And if indeed we need additional requirements, additional resources to monitor our borders between Quebec and also between Maine. We will make that request through the federal government to the armed forces if necessary. Right now, we believe we can manage that with the resources we have because that's where we put our focus. We don't have that same focus in between Nova Scotia and PEI and New Brunswick for obvious reasons. But if we feel that we aren't able to understand exactly who's coming and why, and we need greater resources, we will not hesitate to request additional help.
Thank you, Premier. Adam Harris, Brunswick News.
Thanks, Bruce. Question for Premier Higgs. Premier, there's been a Pfizer delay, there's been a Moderna delay, and Prime Minister Trudeau said today that domestic manufacturing of COVID vaccines inside the country won't happen until next year. I just want your thoughts on this. Is this rollout a failure, or are these kind of things expected? I guess your thoughts.
Well, I think that's just going to be a major topic of discussion on Thursday evening with the Prime Minister and my colleagues across the country. I think we've learned that through this pandemic is that if you must be able to depend on one another throughout our country, and whether that be in the face of the vaccines, whether that be in the face of our energy source, energy supply, and our future economics. But right now, it's about vaccines. And right now, we should be looking to find locations that can make this vaccine. I'm sure that we'd be able to work with other, like with Pfizer or Moderna or others in terms of being able to understand the formula and the requirements. But where do we have the facilities? I understand that certainly there's one there potentially in Alberta and maybe in Ontario. And I recently saw the notice about supplying support from the federal government to create a facility in Montreal. But that facility is just being built. That's a long ways away. If it's good to talk about it now, but right now it's time to act. And the quicker we can have vaccines being made and distributed in Canada, the better. And on Thursday evening, I anticipate this will be a major topic of discussion, and we need precise information on when we're going to receive vaccines and how we can help the federal government and work as provinces so that we actually can say, here, this province is closest to having a vaccine capability for manufacture, and then let's all rally the troops to do that. Let's not talk about next year and when a vaccine might come out next year. Let's talk about how quickly we can get them distributed and manufactured this year, right here in Canada.
Bobby Jean McKinnon, CBC.
Yes, hello. Dr. Russell, can you tell us a bit more about the staffing situations at the long-term care homes in Edmonton? Like how many of the infected employees are healthcare workers? How many others are off isolating? And how many positions still need to be filled?
In terms of employees and the outbreaks, I know that we have 37 staff that are out right now in terms of healthcare workers. So that's the total. And then in terms of spreading out that around the different, that's 37 staff between two of the long-term care facilities. So, and again, my understanding is they have had great success in getting volunteers to go up there to date, but that is still being worked on.
Sophie Desautels.
Oui, bonjour. Ma question est pour le Dr. Russell et pour le Premier ministre également. Il y a une pétition qui circule en ce moment de la part de travailleurs qui font des rotations à l'extérieur de la province, qui trouvent injuste le fait de devoir s'isoler 14 jours à l'extérieur de leur maison sans pouvoir voir leur famille. et demandent que le gouvernement paye pour leur isolement s'ils doivent s'isoler 14 jours en dehors de leur maison. Qu'est-ce que le gouvernement a à répondre à ça?
We actually have set up to work with families that don't have the adequate facilities or not able to do that, and where we have locations identified that they can isolate in, and we will work with each situation to determine how they can manage that. And I'm comfortable that we'll find a path forward, because our goal is to ensure that isolation is possible where we deem it necessary, and we'll work with the people to make that happen.
Thank you, Bruce. Tom Bateman, do you have the quickest question?
Yeah, let me try. This is for Dr. Russell. Doctor, I remember you warning that we won't be back in the yellow phase of recovery for some time. I wonder if it's realistic for New Brunswickers to anticipate, the relaxation of COVID-19 guidance beyond, the current orange level restrictions at any time before the bulk of the population has been vaccinated. Thank you.
Well, we certainly will continue to review all of the information that we have as things evolve. I mean, the goal right now is to get our long-term care facility residents vaccinated in terms of that vulnerable population, and we are limited by supply of the vaccine right now. So definitely, until we have our vulnerable populations vaccinated, we definitely will have to protect not just the vulnerable populations, but the rollout of the vaccination of those vulnerable populations, because once we get into really tricky outbreaks, and there are many healthcare workers involved in just dealing with the outbreaks and people that are hospitalized as a result and people that are self-isolating as a result, that pulls the resources away from our ability to immunize those populations. So we really need to make sure that we keep our numbers low while we roll out the vaccine campaign. And again, we are limited by the number of doses we're going to receive in the short term. And again, it's going to affect how long it will take to get those vulnerable populations vaccinated. So I think we have a ways to go before we can relax those measures. You're exactly right. It is hard to predict at this point how long that's going to be.
Neil Ibrahim, think you can go faster?
Yes, thank you. How do you decide which COVID-19 positive samples get tested for the variant? And how do we know for sure the variant isn't already in the community?
So as of right now, there are criteria that we use. All our samples do go to NML, and they will eventually all get sequenced. But if we want to receive a result within a week, which is the fastest turnaround time that we could get, there is a prioritization criteria that we use. So it includes, I don't have the full list, but it does include international travel from a risk area. And again, it could be also, if there is a sense that there is more of an attack rate or more transmission than we expect. So a different pattern, obviously, of that would be more like the variant. So there's a few criteria that if people meet them, then we send those samples for prioritization that will give us a week turnaround time.
François, très vite.
Oui. Alors, ma question est pour le docteur Russell. À partir du moment où les résidents et les employés des foyers de soins auront reçu les 2 doses du vaccin contre la COVID-19, qu'est-ce que ça va changer du côté des restrictions selon les couleurs de zone? Est-ce que les visites des familles pourront reprendre? Et si oui, avec quel genre de restrictions?
Alors, à ce moment-ci, on ne peut pas dire que ça va changer beaucoup parce que les gens qui reçoivent le vaccin peuvent encore le transmettre. Alors, on va le protéger, les résidents de foyers de soins, parce que les gens qui demeurent dans les foyers de soins, ça veut dire qu'ils peuvent encore avoir le COVID-19. Les gens qui viennent leur visiter peuvent avoir le COVID-19 quand même, qui sont vaccinés. Alors, ça veut dire que la transmission peut continuer, sauf que les gens qui sont vaccinés vont être protégés des effets très sévères. Alors, ça veut dire qu'il y aura moins de gens qui auront besoin d'être hospitalisés, moins de gens qui auront besoin d'être admis aux soins intensifs, il y aura moins de décès. Alors, ça va éviter les situations comme ça, mais ça ne va pas éliminer le risque de la transmission de COVID complètement. Alors, les mesures qui sont en place maintenant vont rester.
Dernière question, Héloïse Rodriguez, Radio-Canada.
Oui, bonjour. J'aimerais juste savoir quelles sont certaines des options qui sont envisagées pour resserrer le contrôle aux frontières. Parce que vous avez parlé de ça. C'est quoi certaines des possibilités qui sont sur la table?
I think that what we're looking at doing here is basically increasing our visibility at the border, increasing the questions and where are people going, why are they going, how many are related to unnecessary travel, because we know there are people traveling. We're going to try to keep obviously the economy moving, but we have to look at essential services and essential travel. And we know there's a percentage that could be debatable and whether it's essential or not. So we're trying to balance this, but it is going to become tighter than it was before. Because of this variant, it makes it even more critical for us to be diligent. Our entire success is based on what we can do at the borders to control the entrance of the virus coming into our province. And then from there, it's being able to identify where people are going and what they're doing and who they're coming in contact with so that public health can react if there is an outbreak or a concern. And to date, that has been the success. So we are just going to be tighter scrutiny and more, I guess, risk intolerant in relation to who can come and who cannot.
Donc, mise à jour. That concludes today's update. Thank you.